All right, so as everybody knows, we are here tonight to talk about personal exoskeleton technology and specifically the ReWalk. As you'll see as we get into things, some of the stuff I'll talk about, including the health benefits and whatnot, apply to any personal exoskeleton technology, but my background and expertise is in the ReWalk specifically, so there'll be a little bit more information about this particular device. So objectives, things I want to get covered for tonight. I want to introduce you all to the system, including the FDA indications for use. It is a device that is pretty highly and strictly regulated by the FDA, requires a prescription to utilize. We're going to review the implications of spinal cord injury on an individual's health and the goals of powered exoskeletons. We're going to summarize the health benefits that have been demonstrated from utilizing powered exoskeletons regularly. And then we'll chat a little bit about the how part of things. And if something like this does interest you and seems like an appropriate fit for you or someone that you know, I want to give a little bit of an overview of what that process looks like to go from interested to home user. So we're going to start with a quick video so you can get your eyes on a little bit on what the device is. So it's powered at the hips and knees. It is controlled with a wrist unit. You see Ashley there selecting the mode she wants. And then it does all the work of walking, standing, and stair climbing. Right, just a quick little snippet there. So what does this device offer? So really unprecedented freedom. It offers access to real world environments, including locations with stairs and curbs. It provides a natural gait pattern. So it adjusts at the hips, at the knees, and at the ankles. So you can see the little ankle joints down at the bottom there on the right. They're adjustable similar to how an AFO brace would be adjusted. So it can be tinkered very precisely to each individual. It's designed to really go with you everywhere in your life for at least 5 years or 1 million steps. Super robust with a long battery life that's really help you feel comfortable getting out there and doing the things that excite you, like 5Ks or walking into your mom's house, or we've had some people do marathons. So there's lots of different ways that people utilize this device, but it's built very strong and robustly. As I mentioned, the customized fit. So it's configured. We have a big clinical team who comes and helps configure it very specifically to each individual. We have a huge dedicated customer support team that helps you understand about the process of getting a device, training in it, and using it at home. And we have, at this point now, a vibrant worldwide community of users who are using this device. We have over 800 individual users across mostly the US, Germany, and the UK, and then sprinkled here and there throughout other parts of the world as well. So this is sort of dry, so bear with me here. But like I said, this is a very strictly regulated medical device. And when we got our labeling with the FDA in 2014, these are the conditions that we are allowed to utilize the ReWalk in the US specifically. So it's intended for both indoor and outdoor use. Standing, walking on level and slightly unlevel surfaces, slopes, and then ascending and descending steps and curbs. The bottom two boxes, you'll see there's a difference between using it in a rehab facility versus using it at home and community. And it's a minor difference, but basically, if the device was to be kept in a rehab facility and used with a physical therapist, people with a little bit of higher level of spinal cord injuries could utilize it, all the way up to level T4 and below could utilize it with a PT. But really what we're focused on here today is the middle box here. So for home and community independent use, the main criteria is that you have a spinal cord injury at the level of T7 or below. Okay, so we dive into that a little bit deeper, because that's one of the first questions that people always have is, am I eligible? Am I qualified? And so you'll hear me say this a couple times. The title of the presentation was for paraplegia. Right now, for home and community use, the ReWalk is only for individuals with any type of spinal cord injury. So that could be traumatic, whether from an accident or fall, something like that, or atraumatic from something like a tumor or any other condition that might lead to the spinal cord being damaged and losing function at the level of T7 and below, anywhere in that range. Part of that is because the device, we do need you to be able to have enough trunk control to activate the features, as well as hand and arm function that can utilize the crutches. So as I mentioned during the video, the device is powered. It's very powerful. It does all the work for you at your hips, knees, ankles. But what you do as the user is you sort of let the device know which direction you want to go in when you're ready to start and stop by doing things with your upper body and your arms. The crutches specifically also help people to be independent with their balance and a lot more mobile throughout the community. Some of these other things are very specific that your doctor would help you work through to make sure that medically you're eligible and a good candidate. So those things might include looking at the strength and health of your bones, your standing tolerance to make sure that you don't get dizzy or maybe pass out from being in the standing position. We need you to be able to tolerate the standing position. In general, good health. That just means no other major medical concerns going on that would make it unsafe for you to be walking. And then some basic height and weight requirements, because the device is very rigid. And so there are just very sort of straightforward limitations in how big it can go and how small it can go. So when we're thinking about these devices, we want to know, what is the goal of these? Why would we bother going through all of this and even talking about all of this? So we come down to these three sort of main goals. We want to be able to provide access to independent ambulatory function in the home and community. It's important for everybody to understand that these devices are amazing. As you can tell that I love them so much already, but they're not yet at the point where they're replacing wheelchair use for individuals, okay? So folks who utilize and own a personal exoskeleton, they're still full-time wheelchair users. This device is intended to add to your sort of bag of tricks to help keep you as healthy and well as possible for the remainder of your life, essentially. And so that's where we see the second and third bullet points coming in here. And so the idea is that by having regular access without the need of going back to physical therapy or anything like that, access to a modality that can help reduce some of the secondary medical complications and improve long-term outcomes, including quality of life. And we'll dig a little bit more into the specifics of those two things here coming up. So physical activity, why is it important to move around? So for anybody and everybody, physical activity is a modifiable risk factor for death in the able-bodied population. So basically, this is something that we've known for a long time, is that if you want to be as healthy as can be, you have to engage in physical activity. And again, for anybody, even those without spinal cord injury, being fit is associated with about a 50% reduction in the risk of developing secondary health complications and early death, basically. And walking is widely accepted as a healthy physical activity that promotes wellness and reduces the risk of secondary medical complications. And so again, this is just a general statement for the human population. When we look at those who are currently living with spinal cord injury, unfortunately, we see that they are struggling to achieve physical activity goals. Basically, the recommendations are for around 3 times per week, at least 30 minutes of moderate to vigorous physical activity to maintain good health. And we're finding that about half of the spinal cord injured adult population is reporting no physical activity at all. And only 12% are meeting those physical activity goals. So this is just a huge unmet need in this population, right? And I'm potentially preaching to the choir here, depending on who's on the call here with me. But, it's something that we know that we need, but it's a hard thing to achieve for anybody. And then for folks with mobility restrictions, it's that much harder to get in that regular, moderate to vigorous activity. We also see that just walking in and of itself is a main priority for individuals and medical professionals for, people living with SCI. So on top of the physical activity need, we just see sort of the quality of life and just desire to be walking again. And that is shown in the research as well. And what we do see is that for the SCI population specifically, research shows that powered ambulation can provide the relevant physical activity and significant health benefits in this population. And this is just a quick, I mentioned sort of briefly that the ReWalk is the only personal exoskeleton that does have access to stairs function. And when we think about why that's an important feature to have, it's basically because it increases the amount of times that we see people utilizing the device. So the ReWalk has always had the capability to perform this function. The device was invented way back actually in about 2004. By the time it got through all of its testing, it got clearance in 2014 for FDA and the rest of the world. So it's called CE clearance for the rest of the world. That was in 2014. The device, since that time, has had the capability of performing stairs function. Unfortunately, the FDA had a little bit stricter policy on safety, and so they didn't allow personal exoskeletons in the US to utilize that stairs function. So for about 10 years, users in the United States did not have access to the stairs function, but users in Europe did. And so we were able to go back and look at our data and end up submitting this to the FDA to sort of prove that it was safe and an important piece of the technology. And they agreed about almost exactly 1 year ago. We got the clearance opened up for US users to use the stairs function on their devices. And it's for this reason that you see here. We found that folks who have the option of climbing, it's usually just a step or two into a loved one's house or maybe a local barber shop, places that aren't easily wheelchair accessible, they increase how frequently folks are utilizing their devices. And by increasing how often people are using them, they're getting the health benefits that much more robustly. And that's truly what it's all about. So speaking of the health benefits, what are exactly the health benefits of getting your physical activity through using a powered exoskeleton? So there's a lot to look at here. And it's basically just a snapshot to let you know that this has been a very highly researched area since prior to us getting FDA approval. So Dr. Eskenazi out of Moss Rehab, actually in Pennsylvania, was one of the front runners and leaders in evaluating exoskeletons in this population. And so that's his name at the top there way back in 2012. And since that time, this isn't even all of them. This is just sort of a list of some of the bigger and more popular studies, but there's a ton of human clinical evidence showing the powered exoskeletons are both highly effective and safe for restoring ambulation and providing the health benefits that we see across the top of this chart here. And so we're going to dig into them a little bit in the next slide, some specifics from these studies to look at exactly what we're talking about. But the categories that you see here of things that we most commonly see reported in the evidence are just improved physical activity. So how often and how vigorous is the activity that you're getting? Bowel and bladder function, pain reduction, spasticity reduction, improved sleep, decreased healthcare costs. And so we think that's related to things like less skin issues from sitting, less UTIs, less medical visits and things like that, just from improved overall health. As you can see, there's only one study for that, the healthcare cost. And so that one is one that hasn't been looked at as strongly, but sort of makes sense if you think about the bigger picture. Bone health, so helping to keep your bones stronger over the years, and then quality of life and social participation. Okay, so when we dig into a couple of these studies, and I'm not going to read through all of these here, but basically what we're seeing is that when you use a powered exoskeleton to ambulate, you are elevating your heart rate to a greater level than non-exoskeleton walking. And so that might be walking that you're performing just in the parallel bars with the assistance of a physical therapist, or with non-powered braces like KAFOs or AFOs. You're just able to get more vigorous levels of activity with the powered exoskeleton. And essentially, this leads to an improved likelihood of cardiovascular fitness for folks that are using this type of powered exoskeleton versus non-powered walking. And some of these other things are the result of that. So from getting that moderate to vigorous activity on a regular basis, we see soft tissue body composition improving. And so what that means is reduced fat mass and increased lean mass of your body. Reduction in the time needed for a bowel program. So improvements in people's bowel programs is honestly one of the most commonly reported, both anecdotally from folks who just trial and use the device and in the clinical data. So not only in reduction in time needed, but less physical assistance from others needed and more regularity in your bowel program. And it's a huge factor for a lot of things to do with just how your day works, right? As I mentioned, some increase in bone mineral density, so the strength of your bones, decreased risk for fracture. And then this last one was a systematic review. So this looked at a bunch of studies all together, and it just showed again and again these sort of those categories on the chart that we looked at. So pain, spasticity, bowel function, strength, balance, quality of life. Is just confirmed over and over again. And so that was in 2022, all the way. So we have over 15 years or so of strong clinical data supporting why this particular modality, again, rather than, it's not just walking, it's this powered walking that gets people these excellent health benefits. And this is just a survey that we performed with our patients to see, are folks, is this just in the clinical data or people reporting this as well? And so these are individuals who responded to a survey that we did last year and confirmed a lot of the same things, right? So spasticity, trunk control, quality of life, mental health, circulation, pain management, bowel and bladder function. All right. And so then we're just going to wrap it up at the end here of how does one go about getting one of these? So, in addition to the medical eligibility requirements, that's sort of one of the very first things is, does an individual have a spinal cord injury at T7 or below? The other thing that we have to consider, for better or for worse, is the coverage pathway. And, this is something that we think it's important to not offer false hope for individuals. Most individuals are not able to just pay for devices like this out of pocket, unfortunately. And so as a company, we've worked really hard over the years to develop coverage policies with these different payers. And so the first one that we were able to get a policy with was the Veterans Administration. And so that was actually back in 2015. They came on board pretty quickly. And so we're able to serve veterans that are eligible on a very broad basis. So that is amazing. Workers' compensation is very variable, but we've had a lot of success with working with the various workers' compensation policies. And then most recently, we were actually able to get CMS, or the Centers of Medicare and Medicaid Services, to agree to a coverage pathway. And so this is super exciting. Now at this point, about 40% of individuals living with SCI are covered under one of these three policies, whether it be veterans, Medicare, or a workers' compensation insurance. And so that's not everybody, right? 40% is 40%, but these are the ones that were able to get it paid for at this point. And not to say that we don't work with individuals to, do fundraising or, other pathways is possible. But, when you're thinking about what is the most accessible way, these are what we currently have established policies for eligible individuals. All right, so the process, it's not nothing, right? So I'll say that. You'll see here it's written out in 7 steps, but you need to be motivated and ready to sort of do some work to get through the process here. So first things first, you need a referral from a provider. So that can either be your physical therapist, it can be any doctor, really. It's most commonly, though, your PM&R doctor, your physiatrist, your sort of your spinal cord injury doctor, if you're still seeing that person. Sometimes it's a neurologist. Sometimes it's even just your primary care physician, if they're willing to sort of learn about the technology and work with you enough to write the prescription for it, then that can work as well. But that's how we start, is by a medical professional putting a referral in, and we begin the screening process. So we have a strong team, clinical team, both internal and a field presence, that we work with that provider, whoever it is, to figure out if this is a good fit. And not obviously everybody is going to be a good fit, like anything. But you saw those things that we walked through, and level of injury, some other health things, size, height, weight, stuff like that. So we do some screening to figure out if we think that you're going to be a good candidate for it. Once we get through that piece, we do a trial. So our team will come out to your physical therapy clinic with a trial device. You'll have some time to do some standing, do some walking, learn about the device, sort of understand better how it feels and what it can do for you. And if at that point, you tolerate it well and feel like it's something you're excited about pursuing, then our team does really all of the work of submitting to your insurer to help get it reimbursed. Additionally, you'll begin training right then with the ReWalk specifically. So there's no waiting in between. We think it's important, if someone is interested and eligible, to get this technology in their hands as soon as possible. And so really from the moment that that eligibility is determined and you're ready to sort of sign off that, like, yes, this is something I want, we leave a brand new device with you and your physical therapist that day, and you begin the training process. The training process is, not to overwhelm, but it's all of these skills. And so it's not a certain length of time for training, but rather it's a skills-based training. And so the main thing is just that you're comfortable using this safely by yourself in the home and community. Now, when we say by yourself, it's important to note that part of the labeling is that it's called a companion. So that can just be anybody in your life. Could be literally anybody, a sibling, a neighbor, or somebody that comes to some of the training sessions with you and learns how to help you if needed. So some people are able to get through all these skills and they really don't need any help at all when utilizing the device, and that's great. And they just have someone in their life who they can call if needed. Some people need a little bit of hands-on help to do some of the skills when they go home, and that's okay too if they have someone in their lives who can help with that. And so basically you and your companion have to demonstrate to your physical therapist that you're able to do all these different skills, and once you sort of get checked off on each skill, then you're officially cleared to take it home. And we teach you how to put it in your car, how to transport it, how to charge it, how to maintain it, all those things. And then we send you off and you enjoy using it, hopefully multiple times per week, to get all those great health and wellness benefits that we talked about. and then use it in your life. And so you can see here, different pictures of people using it in many different ways. And then I just want to briefly speak to LifeWord as a company. And so some folks who have been familiar with us for a long time, the ReWalk device was developed by ReWalk Robotics. So for a long time, we were known in the industry as ReWalk Robotics. In the past year, we have just grown as a company and actually have other products that we sell as well. And so we've expanded and rebranded to LifeWord. And so if you do end up pursuing a ReWalk Personal Exoskeleton, just expect to hear this word LifeWord and your LifeWord team. We're going to be the ones doing all of this with you and partnering. So the device is still the ReWalk, but the company that works with you and sells it and maintains it, all of that stuff is called LifeWord now. And these are some of the other products, like I mentioned, that we have. And that's it. So ReWalk, we're suited for your mission. We are ready and able to help you achieve your goals. And then we have just a references slide, because that's always good practice. And I will stop sharing and we can do some questions and comments now.